Hi, this is Dr. Kurt Woeller. One of the things I've seen in practice over the years is when parents try to figure out with their child, is the behavior they're seeing related to autism or is it age appropriate? If you are a parent who has a neurotypical child that may be older than your autistic son or daughter, you've got some kind of reference point to look back on. How did they develop? How did they progress? At what age were you starting to see certain behaviors? And you have to apply that to your autistic child. If you're a parent who only has a child on the autism spectrum and you don't have another child in your family to reference to, it can be a little bit more difficult, because what you're trying to determine is what you're seeing behaviorally somehow related to the neurological condition, or is it just typical for kids that age? What I recommend parents do is buy some books on childhood development. And there are a series of books that you can go to any bookstore and find these, typically. And there are books that talk about age development from a certain age, whether it's birth to 2 years or 2 years to 5 years. And depending on where your child is in age, whether they're 3, 4, 5 years old, and they also are on the autism spectrum, is read about what is typical for kids that age. Because not everything is autism. Some of it just may be the fact that they're a typical age and manifesting with age-appropriate behavior. One other tidbit of information I want to give you is, when you start implementing therapy, whether it's biomedical therapy and sometimes non-biomedical therapy, speech therapy, behavioral therapy, etc., many times kids on the spectrum come out of their fog, so to speak, and they start becoming more aware of what's around them. The environmental awareness increases. So even though they may be age 5, they might now be manifesting with behavior of a 3-year-old or a 3.5-year-old. I've seen kids who were 6, 7 years old and being lifted out of this autistic condition, for many of them, become more aware, their speech is improved, their socialization improves, they have less anxiety, but now they're doing some immature behavior because they haven't quite caught up. And so that has to be appreciated too. So think of that, okay? Think of that with respect to your kids. Is the behavior you're seeing typical for autism or just typical for their age? Thanks.